Well, good afternoon. I'm really excited to be able to bring some folks together with a really inspirational story concerning the use of convalescent plasma to treat folks infected with COVID-19. It's an antibody-rich plasma portion of the blood that is being administered to patients, and we have a great story here about how this is something that has helped save lives. And I think it's something to point out. If you look at what we've been doing in the state of Florida, we are conducting antibody testing at many of our sites. We're doing at least 1,000 tests a day now, we're averaging. And from the 4th of August to the present, every day we've had at least 20% of those testing for antibodies test positive for antibodies. And so that has implications for and it's not scientifically representative of the state per se. These are people that are coming on a first come, first served basis. But clearly there's been an increase in the seroprevalence in the state of Florida, and I think that has been probably the major factor in seeing some of the diagnostic testing going down, the percent positivity going down. I mean, for example, yesterday in Miami-Dade at our Miami-Dade Hard Rock site, we did point of care diagnostic testing for the virus, and they had a 6% positivity rate on, I think, about 650 of those point of care tests. The antibodies have been testing positive at that site at well over 20% for several weeks now. And so, that obviously has implications for the spread or the slowing of it, which is very important. But all those folks who do have the antibodies have an opportunity to help those who are still suffering from the disease. And you can do that by donating your blood. We have hospitals around the state have been using this day in and day out. And I know that we have folks from Ascension here, Dr. Kafrani, and they are doing well with it. They've got a lot of supply, but I think it's always a good thing to be willing to go in and give. So our message is, if you do have these antibodies, well, one, get an antibody test. If you're somebody that thinks you may have come in contact with someone in the past, maybe you think you had an illness in the past that you didn't get diagnosed, go take the test. I recommend, if you're totally asymptomatic, that the antibody test is better to take than a PCR test, because the PCR test, you can't even identify an active infection with that. Whereas an antibody, those are real antibodies if they identify it. So we encourage people to take advantage of what the state's offering. But if you are positive, we absolutely ask you to be willing and consider to donating, your blood, because it can be used. And so today, I think we'll be able to show why this is important. I'm joined by Gail Murray. I'm joined by Gail's daughter, Terry Isaacs. I'm joined by Terry's husband, Steve. And then, as I mentioned, Dr. Kafrani, a pulmonologist and critical care physician from Ascension Health. So they're from Northwest Florida. So Gail, she was treated at Ascension in Northwest Florida, has recently recovered from COVID-19 after receiving her son-in-law's donated plasma. And Gail's story is expiring. It shows how folks, in this case, a family, a son-in-law, can help potentially save somebody's life by donating the blood. So it's I think, a comforting story. You hear a lot about anything that's bad will get a lot of press, but sometimes I think it's worth reflecting on some of the great things that are being done on the medical side, and just also Floridians stepping up to help folks in need. And so we're really happy to have Gail here, to have her daughter and son-in-law are here. So Gail, why don't you introduce yourself? I mean, we had the pleasure of speaking with you. I mean, I think your story is really inspirational, and I think, though, it gives people hope out there who may be in a similar situation, or maybe they know a friend or family member in a similar situation. So,
Absolutely.
So
Yes.
please, the floor is yours.
Okay. Well, when I was in the hospital, I was really sick, and I know that I would not have made it had I not received the plasma from Steve, without a shadow of a doubt. I was so sick that I knew and had pretty much prepared in my mind that, that was the way I was going to go, not being with my family, not being able to see any of them. And then when they gave me the news that they had worked with my doctor at UAB, Ascension had, and they were working together, and it was so much hope, and hope is so important in your life. And it was absolutely life-changing to get that plasma. I have felt so good. I mean, in just a few days, I went from thinking I was going to die to literally feeling, why am I in here? I'm ready to go home now. So please donate. It is so important. It saved my life.
Well, thank you so much. Terry, can you talk about, can you just explain kind of how COVID affected your family from the beginning? Because it's an interesting story. And then how, the family had to respond. And obviously, you were infected and you had to get over it, which wasn't easy either. But if you can tell folks kind of the background that led up to the life-saving donation.
Absolutely. So I became ill the first week in March of this year. And of course, originally at that point in time, COVID was really not something that was affecting our area. And so we just honestly thought I had a sinus infection. I was getting worse. Then I was diagnosed as having possibly bronchitis, and then the next day I had gotten so progressively worse that it ended up in at the hospital. And I was the first person at the Sacred Heart Ascension on the Emerald Coast to be tested for COVID. And so I was in the hospital for 10 days. And during that time period where I was in the hospital for 10 days, my husband and my mother both began running fevers and started their COVID journey, so to speak. And my husband and I were both in the hospital at the same time. And we were on the same quarantine ward, but in separate rooms. And I got out on a Sunday. He got out on a Tuesday. And then at that point in time, my mom was still running her fever, and so the day after Easter, she ended up in the hospital for 11 days. And so it was one of those things where my siblings and I had really had to come to terms with the fact that this may not be something she would survive, with the fact that she has leukemia and such an incredibly compromised immune system. And she just wasn't fighting it at that point in time. She was running 104 fevers, and her oncologist was extremely concerned, and he stayed very, very involved in the process. And it was by his suggestion, in working with a Sacred Heart, to go with the convalescent plasma. It was still kind of new at that time for our area. In fact, we were the first ones to do that, and the first ones to donate at the One Blood bus in Panama City. So she received the plasma at 7 o'clock in the morning on a Sunday, and by Tuesday she was fever-free, and by Thursday we were picking her up to come home. And it is crazy when we think back about the fact that on Sunday and Monday, the siblings and myself were having to come to grasp in reality that she may not actually make it. So it was a journey.
Well, Steve, you were the one that made the donation. So you talk about how that came about, and I know that it was a very consequential thing. So thanks for doing it.
Yeah, thank you. It really was, and I mentioned, it was so new, talking about the convalescent plasma, and we had to get tested. I really didn't even know what my blood type was, but I ended up having what they called it golden blood. I'm O negative, so I can help. I can help anybody with my blood. So I was excited to be able to go and help. And with the plasma donation, I was able to dedicate one portion of it to my mother-in-law, and the other two went to somebody else. So I'm hoping they did well with it too. But we kind of joke. I've got a sweet tooth, bad sweet tooth, and after my mother-in-law, she said, "I crave sweets." I said, "Well, you probably got that from me." But it was I was excited to do it, and given a chance to do it again, I'll do it as many times as I can.
So what was it like? So, you donated the blood, obviously, then they administer the treatment, and then you guys just sitting there hoping and praying that it kicks in, or were you getting updates? What was that time period? Because I know the resolution, I mean, it happened pretty quickly, but it was still, a couple days probably before it did. So what was that like?
Yeah, so again, it was so new that, we didn't know really what to expect, but to find out how she started getting better almost immediately. We knew it was something that was going to be big for the treatment of COVID, and we were again glad to be a part of that early process.
Great. Well, thank you for stepping up. Dr. Kafani, can you just talk about some of the evolution of the treatments, of how you guys have handled this? But then also, if somebody is infected with COVID, at what point is the blood because I know the IgM antibodies and the IgG, but it takes a little bit of time. But if they give right at the outset, is it the same effect, or do they have to wait for the antibodies to more fully develop?
As far as the treatment, I mean, it's interesting that at that point in time, we did not have a lot of treatment. So that was one of the very few things that we could do. And it's awesome that it does work for some people. So this is a great story. As far as when to get it or when to give it, as soon as the person is PCR negative, then by then they have the antibody to have fought the infection, so they should be able to give it. So you don't have to wait a certain period of time. As long as you're not giving the infection with the antibody, you should be okay to just give blood to be able to give the antibody.
Do we know the response is obviously very positive in some cases? In some cases, you don't really see improvement in patients. Do we have understandings as to why that may be?
We do not. We're actually still waiting for the data because the data is still being collected. The FDA just sent a memorandum as far as like the safety of it, but we don't have the conclusion as far as who gets better and who doesn't. But what we do know, what we seem to find out from practice is that it seems to work for earlier rather than later, like the earlier in the course that you give it. And it seems like when it does work, it works pretty fast. You see the effect pretty fast, but that's still anecdotal. This still has to be proven.
So if somebody's admitted to the hospital for COVID, would you immediately move to convalescent plasma, or would that be once they reached a more critical stage?
Yeah, if we believe that they're trending the wrong direction, then we directly move into giving them the plasma. That is correct.
And that's even before admission to like the ICU?
Yes, that is correct. Yeah, I mean, as long as they're trending in the wrong direction and things are not, I mean, they seem to be getting worse. Like I said earlier, I mean, the earlier the better to give it. So that's basically what we do now. Now, are we going to be doing that in a month? We don't know. The more data we get, the more we know about this disease. It's changing on a daily basis.
Right. And your hospital census, what was your peak for COVID positive? Sometime in the middle of July, third week of July?
Yeah, probably around 3 weeks ago.
Yeah. And you've seen pretty consistent downward trend in admissions?
It's been pretty consistent, and now we're seeing the downtrend in the ICU, which usually lags a little bit behind.
Good.
Well, first of all, I have to say, Steve, you set the gold standard for a son-in-law, so I don't think you can top that. But I think your story is phenomenal in the sense that your family all rallied around each other and that you donated. And, one of the things that I see a lot of, and just watching a lot of the roundtables from a distance or speaking with parents of students, a lot of students are very concerned, what does this mean for my future? They're having a hard time processing what is going on. And I think one of the things that your story really illuminates to so many people is just that of hope. You know, we should never give up hope. We should always look forward to this won't define us. We'll be bigger and better and stronger for it. And I think your family sitting here, talking about it really embodies that. So, Tara, I know that's very, very, very much true. Gail, I'm sorry. Tell us a little bit, though, about how this makes you feel to be here, to share this.
Well, I feel very proud in some respect. At the time, it was devastating to everyone, and to share a happy story that I made it through was just, I mean, it is just the most incredible feeling to know that I've gone from really feeling that I wasn't going to make it to, in just a few days, feeling great. I'm ready to go home. And it gave everybody, you know, such a high, such hope, you know, it was just unbelievable. And Terry also donated her plasma and was able to save someone in Pensacola.
Talk about that.
So the day that we determined that Steve was a perfect match for my mom, one, because he was actually not a family member and he had the O negative blood, they went ahead, I knew my blood type already, and through the coordination with Sacred Heart, I received a phone call the same day that he was going to donate his plasma, and they asked if I would be willing to donate mine, that there was a gentleman in Pensacola that was in ICU on a ventilator that I was a match for. And so, of course, without hesitation, I went and donated that same day, that afternoon, to the One Blood bus in Panama City. And from what I understand, the gentleman did make it. And so it's a great story.
Can you talk about how how you got infected? I think you had told us that before.
Yeah, you know, there's always that you wonder where it was that you may have gotten it. And for the longest time, we thought we had our thumb on it because we had returned from Key West mid-February, right where the cruise lines and that sort of thing were. And so it just, to us, it made perfect sense because truthfully, other than that, we don't run around, you know, the country a lot. Once we got home, we were at home or with family or at work, and so our exposure was fairly limited until I realized the other day that there was a gentleman that is a New Yorker that I had come in contact with. I realized that I'd come in contact with him in February towards the end, and realized as I've gone through the process that he was sick the entire month of March with COVID. And so the suspicions are that that's where I came in contact, and it was literally over coffee at a Starbucks. So that's how quick and fast and innocent that you can get this virus. It's very contagious.
How are you doing overall with your health, just apart from the recovery from COVID?
I feel great. I really do. One of the things I wanted to say, too, about donating your blood, if I may.
Sure.
I have to get IVIGs every 3 weeks, and there's not a time that I don't walk away from that hospital thinking, thank God to those that donate, because my immune system does not produce any immunity anymore, so thank God for that. But the fact that I was so near death, and to have this help again through blood is just unbelievable. And so I really, all of you that donate blood, yay.
Well, and I'll say this too about the convalescent plasma donation, and I know a lot of people don't necessarily understand what all is entailed, and it literally, my process was 45 minutes. They pull the blood out, they cycle it through a machine, and then they put the rest of it back into your system, and they withhold the plasma. And it's it's gold. It's literally, it is a bag of gold. And, the fact that the irony is not missed, the fact that it looks like a bag of gold, and that's what you're using to save people's lives, and that's where the hope comes from.
I think people often wonder, what can they do to help make a difference? And, they're thinking to themselves as they're watching this. And this is one example, just to go in to give blood. It's good to give blood regardless.
Yes.
That's always something that we need. God forbid somebody needs it, but at the same time, if you have those antibodies and you can make a difference, you've saved a life. Son-in-law of the year has saved a life. There's just wonderful things that you can do to make a difference for our fellow man. I think it's exquisite. So, and thank you for taking the time to even come here today to do that.
Thank you, because it's important that people know this.
Yeah, no, absolutely. And we do have antibody testing available at our drive-through test sites, and so people should avail themselves of that. It's also something where if you're somebody who, for example, we have people that work at nursing homes and long-term care facilities, and them, when they have positive antibodies, that is a good thing in terms of the protection that we see and the ability to interrupt transmission. And then in other key critical areas, it's really important to have that understanding. And so we want to offer it. It also helps us just to see how that's progressing. When we started doing antibody testing in May, we did first responders and healthcare workers, and then we opened it up to the general public, I believe, sometime in July. And basically, we've seen a consistent increase in positives for antibodies. So there's a lot of folks out there compared to probably where they were in March in terms of Florida who has the ability to give. So we'd absolutely recommend that you give. How, Doctor, how would you characterize all the various treatments that have been tried? I know sometimes you'll do them in conjunction, but I know we talk about the convalescent plasma, you talk about the remdesivir. We've worked to get the hospitals as much of that as we could. I know they're using, some of the steroids, and there's been other things tried. Is it more like altogether more effective, or do you think one or the other has shown to be effective, just in your experience at Sacred Heart and Ascension?
Right now, what we're doing is giving all of it.
Okay.
So because we know the things that work it seems to be the steroid and the remdesivir. There's still some other stuff that's in trials that we can do, and the convalescent plasma. So usually for somebody who's getting sick or not turning around pretty quickly, they usually get Decadron, they get remdesivir, and they get convalescent plasma.
And the remdesivir started.
Plus or minus
It
other
started.
drugs.
It started in June. You started doing. When did you get your first? We sent it in June.
I think June is.
Yeah, I think so.
When we started.
Have you noticed? So when you only were doing convalescent plasma, and then you started to add the steroid and the remdesivir, has there been better outcomes than when you only had convalescent plasma, or do you think it's been pretty similar?
Subjectively, I would say yes. It seems like we know a little bit more about the virus now, and the people are getting better a little bit more than when we first started. I think it just comes with experience with this virus, because when we first started, we knew nothing about it, and now we do know a little bit. Now, over the next few months, we'll probably learn a whole lot more. So it's just a matter of time to hopefully conquer that thing.
Sure. Steve, any parting words of wisdom?
Well, I guess if I could just say anything, it would be just to give. It's an unselfish way to help others, not only with this COVID, but giving blood is needed. And so I guess my parting word would be to give.
Yeah. Well, thank you for giving. I know that's meant a lot. And Gail, thanks for making the trip over. I think
My pleasure. Thank you.
hope is important, and
Hope is
people need to
very
know that there's hope out there. And I think that this whole experience, as tough as it was, I think is inspirational for other people. So we really appreciate it, and thank you guys so much. I think that this will help increase donations of people. Not everyone even knows about convalescent plasma.
Right.
We've talked about it.
That's right.
We try to get the message out, but people are busy. They got other irons in the fire, and so maybe this resonates, and people decide to come do that. Thank the First Lady too for all she's done, not only for this, but for particularly things like mental health, which are kind of an offshoot of what happens when you have something like this going through the communities. We're going to be talking more about that tomorrow. I will say that I appreciate the efforts of Floridians over these last many weeks. I think that the trends in the state of Florida have been positive now for the last several weeks. As we mentioned, the COVID positive hospitals census has been declining for about the last 3 weeks, consistent with what we've seen in Northwest Florida, and I think it's down over 30%. From the peak, which was probably around the 21st or 22nd of July. That is a trend that was likely indicated by the significant decline we've seen in Floridians going to the emergency department for COVID-like illness. We look at all this data and we try to make sense of it. I think we saw yesterday with some of the test results, you got to take and really dig underneath those test results to really make a determination about whether a particular day's test results are offering us a good indication of the facts on the ground or actual trends. We had a new private lab that had kind of just come online in June submit 7 weeks worth of results from testing in Southern Florida. And so they had 14,000 results that were basically dumped yesterday. And many of the, quote, cases were from the end of June and the beginning of July. And so you look at that, if you didn't know that, you would think, oh man, Miami-Dade, they have all these new cases. Actually, those are old cases. The trend is still positive. And today's report, shows, the trend in terms of the positivity is lower in Dade than it was 2 weeks ago, and it's continued to go down. But so you look at that, you got to kind of make sense of it. But those COVID-like illness visits, we're seeing those decline all across the Sun Belt. Started to go up in the middle of June, peaked in the beginning part of July, that maybe the end of that first week, beginning of the second week of July, and then it's just steadily been declining ever since. That is probably the best indicator that we have, because that's real-time accurate data of people coming in and either being admitted or not based on COVID-like illness. So when you see that decline, you're going to then see the hospital admissions decline, and fortunately, the mortality will decline from there. So that's been the best trend to watch, and that's the trend that we're going to keep looking at. We're told the Department of Health on these test results, we want fresh data. I think that we need to get that done. At the same time, I've also just cautioned people that if you're making decisions at a local level about some of this stuff, just be careful. You got to remain a little bit flexible and to tie it to some of the data and have, say, a kid's future about whether a parent can send a child to school be tied to some private lab that dumps tests 7 weeks late. That may not be the best way forward. So just there's scrutiny that's required, and we look at it every day to try to understand. You also have some other parts of Florida, some more rural areas that may have increased positivity because you have prisoners tested or something like that, which is, that's an important issue in of itself. But that's not something that's really reflective of the overall community. So I think all those things, need to be put in their proper context. But that said, the trends, continue to be positive. I had a number of conversations with CEOs of some of the major hospitals throughout the various regions in the state of Florida. We talked to Tom from Ascension. We talked to David Strong from Orlando Health, John Corris from Tampa General, and Carlos Magoya from Jackson. And they all report the same results that we're seeing, the same positive trends. Carlos told me that Jackson, which is probably the number one system that was really hit when Miami was really increasing, they're down 40% with their COVID positive patients. And I think he said about 25% in the ICU. And I think we're seeing that throughout Dade County, which is obviously a very, very good sign. So the hope of this individual story and to give is really paramount. But I do think people can look at the overall dynamics and feel feel, cautiously optimistic about the direction that the state is going. So we're going to keep working hard. One goal, one Florida. People have been doing their part, and I think it's made a big difference. So thank you very much. I appreciate you guys coming. And if there's anything we can do, please let us know.